All right. Good evening, ladies and gentlemen. Let me start by thanking EVG Network and my upline for bringing the wonderful science of nutritional immunology into my life. My name is Charlie, your MC for tonight's cardiovascular disease webinar. And also a big welcome to all of you for joining us. Now, before we commence the presentation, do take note that all your microphone has been muted to prevent any disruption to the entire presentation. Now, you may use the chat function to interact with us throughout the presentation. We also have a Q&A segment towards the end of the webinar where you can raise your questions regarding tonight's presentation via the chat function, or you can unmute the microphone and voice out your question. Now, if you are using mobile to view, you may maximize your reading experience by zooming in to the slide. All right. So whenever we hear, people pass away from diseases, usually the first thought that comes to mind is cancer. Which cancer got to them first? But no matter how intimidating cancer can be, it still ranks number 2 as the cause of death worldwide. The number 1 cause of death worldwide is actually cardiovascular disease. You probably have seen or heard news of people dying in their sleep, collapse while running marathon, drop dead while happily exercising in the gym. It comes so abruptly, rendering us helpless. Now, according to WHO, which is the World Health Organization, every 1 in 3 deaths are related to cardiovascular disease. Now, with such an alarming statistics, what are the things we need to know and do to avert this disaster? Tonight, we have Denise to share with us how to escape the number 1 cause of death worldwide. Now, let's put our hands together for Denise.
Good evening, everyone. First, I would like to thank EVG Network and my upline. My name is Denise. Today, I'll be sharing on how to prevent cardiovascular diseases. In today's society, medical science is so advanced, but many people die from diseases such as cancer, diabetes, and heart disease. According to the statistics by the World Health Organization, cardiovascular disease is the leading cause of death worldwide. An estimated of 18 million people die of cardiovascular disease every year. It is projected that there will be more than 23 million people dying from cardiovascular disease each year by 2030, meaning in every 3 people, there will be 1 dying from cardiovascular disease. Hence, to keep the deadly cardiovascular disease at bay, we should actively keep the cardiovascular system healthy. So, what is cardiovascular disease? Cardiovascular disease includes heart disease, stroke, heart failure, arrhythmia, which is irregular heartbeat. So, let's take a look at the causes of cardiovascular diseases. They are atherosclerosis, hypertension, high cholesterol, high amounts of omega-6, can cause inflammation in the blood vessels, leading to atherosclerosis, increasing the risk of heart disease and stroke. Let's take a look at how atherosclerosis is formed. Atherosclerosis is a disease in which plaque builds up inside the arteries. Plaque is made of cholesterol, fat, substances in the blood. Hence, unhealthy blood cholesterol levels are a major risk factor for atherosclerosis. When bad cholesterol accumulates in the artery wall, T cells are activated and attacks the bad cholesterol, thereby causing inflammation that leads to atherosclerosis. To eradicate this problem, we should eat a balanced diet, control cholesterol intake to stop inflammation in the body. Another common cardiovascular disease will be hypertension. Blood pressure is the force of blood pushing against the walls of arteries as the heart pumps out blood. Hypertension occurs when constant excessive blood pressure on artery walls. When one's blood pressure reading is higher than 140/90, it is known as high blood pressure. So what is the healthy blood pressure range? Where the diastolic pressure is less than 80 and the systolic pressure is less than 120. Hypertension causes T cells to accumulate in the kidneys, causing kidney dysfunction, leading to the weakening or loss of kidney ability to excrete water and sodium. Hence, hypertension is often known as the silent killer. When one has hypertension, the doctor will also prescribe some anti-hypertensive medications. Have you thought of how anti-hypertensive medication help to lower the blood pressure? Some anti-hypertensive drugs help decrease the amount of blood the heart pumps each minute. An example will be a water pipe. We have to turn down the faucet to have the water flow smaller. And relating back to our blood vessels, it means that the drug only helps to lower blood pressure. But the rubbish or the waste still remain in our blood vessels, hence the drug does not solve the root cause. Another type of anti-hypertensive medication helps to promote urination, which are diuretics. Diuretics inhibit renal tubular reabsorption of water and sodium to increase excretion of water and sodium. This leads to the dilation of blood vessels and lowering blood pressure. The third type of anti-hypertensive medication dilate arteries by relaxing vascular smooth muscles in arteries and veins. This temporarily controls hypertension and reduces its symptoms. Have you heard that taking anti-hypertensive drugs can help to solve hypertension? I'm sure that is a no. Doctors will advise patients to consume these medications for a lifetime. Why is this so? Because if we stop taking, the blood pressure will spike up, as these drugs can only alleviate symptoms but cannot treat the root cause. Let us take a look at the side effects of these drugs. When taking these drugs, we have to be extra careful and follow the doctor's instructions on how to take these medications. These are some of the common medications. Lisinopril prevent blood vessels contraction, but it can cause persistent coughing, kidney problems, dizziness, rashes. Digoxin increases the force of heart contractions, slows irregular heartbeats. The side effects include irregular heartbeats, loss of appetite, nausea, impaired kidney function. Warfarin sodium, a kind of blood thinner. The side effect is nosebleed, gum bleeding, easy bruising. Spironolactone, diuretics. Side effects is poor kidney function, low blood pressure. These medications can only control the symptoms. It cannot help to improve the flexibility of blood vessel walls. Hence, drugs alleviate symptoms but cannot treat the root cause. If we want to improve our cardiovascular health, we have to understand the causes of cardiovascular disease. In fact, many diseases are due to what we eat. What do many of us like to eat? Many of us prefer to eat meat, seafood in our daily diet. According to the American Heart Association, the recommended daily cholesterol intake should not exceed 300 mg a day. Let's take a look at some of the cholesterol in food so that we can choose our food more wisely. For meat and animal innards, pig's brain is 2,530 mg of cholesterol. Cow's brain, 2,054 mg. Pig's kidney, 480 mg. Cow's kidney, 387 mg. Pig liver, 368 mg. Sausage, 150 mg. For seafood, 40 mg for the codfish, prawn, 170 mg, lobster, 85 mg, salmon, 86 mg, crab, 100 mg, cuttlefish and fresh squid, 248 mg. Some say that they don't eat meat or seafood, but they like to consume eggs and dairy products. Let's take a look at the cholesterol in dairy products. Egg yolk, 266 mg. Duck egg yolk, 619 mg. Quail egg yolk, 74 mg. I'm sure we will usually eat a few like 4 or 5 at once. This will definitely exceed the recommended amount. 101 grams of scrambled eggs has 435 mg. 100 grams of cream, which contains 140 mg of cholesterol. There are 100 mg of cholesterol in cheese. Ice cream also has cholesterol. Every 100 grams of ice cream contains 45 mg. 100 grams of milk has 13 mg of cholesterol. Next, we look at cholesterol in oils. 100 grams of chicken lard contains 74 mg of cholesterol. Have you tried pork lard rice or used lard to stir fry or barbecue? Isn't it very fragrant? but pork lard has 56 mg of cholesterol. 100 gram of butter has 260 mg and vegetable oil 0. Although vegetable oil does not have cholesterol, it is a major cause of cardiovascular disease. Let's take a look at fast food. Do you like to eat fast food? Like hamburger and fries? A small burger has 30 mg of cholesterol, a large double cheeseburger 80 mg, fish fillet burger 40, a small cup of strawberry milkshake has 25 mg of cholesterol. From here, we see that our diet can easily exceed the cholesterol intake daily. Hence, we should choose more healthy and low cholesterol food which we can reduce the risk of cardiovascular diseases. Why do vegans even avoiding dairy products and eggs have high cholesterol? Shouldn't they have no cholesterol at all? So where do the cholesterol come from? Actually, 25% of cholesterol comes from the food we eat, and 75% of cholesterol is actually produced by the liver. That is why despite being a vegan, the cholesterol levels can still be high. And why does our liver produce cholesterol? Let's learn more about our liver. Our liver produces 75% of the cholesterol in the body. And let's take a look at why our liver is one of the most important organs. Our liver is the largest gland in the body and it has over 500 different functions. The main functions of liver are detox, filter, and cleanse blood. If our liver malfunctions, it can lead to dull skin. Spots start to show up on our skin. Make bowel. Some people may suffer from digestion problem. This may be related to the malfunctioning of liver, as well as burn fats. It is our major fat burning organ. If you wish to have better slimming weight loss results, we need to make sure our liver is healthy. Regulate blood sugar level. If our quality of sleep is not ideal, it can affect our liver, which in turn results in an unstable blood sugar level. Release of energy. Have you noticed some people are always tired despite getting enough sleep? This is because our liver stores carbohydrates for energy, and when our liver is damaged, it is not able to store carbohydrates. Hence, we must take extra care for those with such symptoms. Synthesize hormones. When our liver is malfunctioning, it cannot produce the needed hormones for the body to function normally. For example, androgen and estrogen, which will lead to endocrine disorders. Especially in modern society, many people are prone to being more tense and stressed, and many hormonal imbalances are linked to our liver health. Make cholesterol. From here, we can see that many health problems are related to the liver. And why does liver needs to make cholesterol? I used to think that cholesterol is a bad thing because high cholesterol is one of the causes of cardiovascular diseases. And high cholesterol requires long-term medication. And in actual fact, we need cholesterol. Without it, we can't live. Earlier on, I mentioned that 75% of cholesterol is produced by the liver. Cholesterol is one of the most essential substances for the human body, which needs it to form cell membranes. Let's take a look at the picture on the right. The smallest unit of our cell is our DNA. Every cell in our body contains cell membrane. So cholesterol plays a very important role in forming cell membranes. In addition, cholesterol is also vital for the synthesis of hormones in the body. For example, the body secretes androgen and estrogens. It needs to have sufficient cholesterol. If the liver is not healthy, it may cause the endocrine system to become unbalanced. Have you heard that sunlight has vitamin D? In fact, there is no vitamin D from sunlight. Our body synthesizes the sunlight we are exposed to and the cholesterol in our body into vitamin. Therefore, cholesterol is an important element in the synthesis of vitamin D. However, we must take note that when our liver produces too much cholesterol, the body's total cholesterol will be too high, which will increase the risk of heart disease and stroke. Every time we go for a medical examination, a blood test contains a cholesterol report. One is LDL, commonly known as bad cholesterol, and the other one is HDL, commonly known as good cholesterol. In fact, Dr. Chao Fei Chen said, our body does not have the so-called two types of cholesterol, good cholesterol and bad cholesterol. When the liver produces cholesterol, it will transport the cholesterol to the cells in need of the body. It is called low-density lipoprotein cholesterol LDL. It's like a seller calling out who needs cholesterol. That is when the cell membranes and hormones will take in the cholesterol. When there is excess LDL, it will directly deposit into our blood vessels, forming plaque. If it accumulates over time, it will cause atherosclerosis, causing severe blood vessels blockage, leading to stroke and heart attack. So the higher the LDL, the worse it is for the body, which is why we call it bad cholesterol. If our liver is healthy, it will produce enough high-density lipoprotein, which is good cholesterol, HDL. Its function is to collect the LDL in the blood back to the liver where it is broken down. It removes cholesterol from the artery walls, prevent atherosclerosis, and reduce the risk of heart disease. So the higher the HDL, the better for our body, which is why we call it the good cholesterol. We mentioned our diet earlier, which will not only affect our cholesterol, but also our liver. If the liver is unhealthy, it will produce too much cholesterol. The health of the liver directly affects the functioning of the heart. When the liver is unhealthy, it will produce too much cholesterol, resulting in atherosclerosis. This in turn affects the heart function. Moreover, liver does not have any nerve endings, so we must take good care of our liver. Earlier on, I mentioned that vegetable oil does not contain any cholesterol. In fact, vegetable oil has adverse impact on health. Why do I talk about oil? In fact, fats is a basic nutrient required by the body where it is divided into omega-6 and omega-3. The Vegetarian Society of the United Kingdom Limited recommends an omega-6 is to omega-3 ratio of 3:1 in one's diet. High amount of omega-3 help reduce the risk of cardiovascular disease, whereas high amounts of omega-6 cause inflammation in the body and increase the risk of cardiovascular disease and stroke. Modern diets contain too much omega-6 and too few omega-3. American diet tends to contain 14 to 25 times more omega-6 than omega-3. Do we usually cook our meals or eat out? Or take away? If it is the latter, then it's difficult to control the choice of oil being used. Nowadays, people like to eat fried food. Hence, the ideal ratio of omega-6 to omega-3 fatty acids in the daily diet should be 1:1 and 4:1. Let's take a look at what types of oil people use at home. Does anyone use grapeseed oil? Many people have heard that grapeseed oil contains OPC, which is very rich in antioxidants. But when it becomes grapeseed oil, it is no longer good for the body. The ratio between omega-6 and omega-3 is, for grapeseed oil, is 676:1. This is so high. Cottonseed oil, 259:1. Sesame oil is an essential during confinement. After confinement, the whole body can be aching as the omega-6 content is very high, causing inflammation. Sesame oil is 137:1, corn oil 46:1, palm oil 46:1. Sunflower oil 39:1. In this table, there is peanut oil 32:0, tea seed oil 32:1. Many people use olive oil. Let's look at the ratio. 13:1, it is also very high. Soybean oil 7:1, canola oil 2:1, macadamia oil 1:1, perilla seed oil 1:4, kiwi seed oil 1:4. So now we know that the oil we eat every day increases the risk of cardiovascular disease. It is no wonder that cardiovascular disease is the #1 killer. In addition to the causes of cardiovascular disease I mentioned earlier, what other factors can cause cardiovascular disease? The factors include malfunctioning immune system, aging where the blood vessels lose their elasticity and flexibility, unhealthy lifestyle, alcohol drinking, smoking, emotions, staying up late, unhealthy dietary habits, lack of vegetables and fruits. Such unhealthy dietary habits in the long run is one of the main causes of obesity and leading to cardiovascular disease. Besides adjusting our lifestyle, what nutrients we can take to prevent the cardiovascular disease, the world's #1 killer? Let me share some superfood that can boost the immune system. Blueberry. Its high antioxidant activity can reduce the buildup of LDL, prevent the formation of blood clots, lessen the burden on liver, lower blood pressure, prevent cardiovascular disease and stroke. Hawthorn keeps cholesterol in check, protect against atherosclerosis, maintain smooth blood flow by dilating blood vessels, regulates blood pressure, improve heart function, and prevent the lack of oxygen in the heart tissue. Oriental raisin tree nourish the liver cells to regenerate, strengthen liver function, lower blood pressure and blood lipids, maintain cardiovascular health. American ginseng prevent LDL oxidation, prevent atherosclerosis, promote liver regeneration, inhibit growth of cancer cells, and balance the immune system. Cactus, the king of plants, has excellent nutritional value, contains more than 10,000 phytochemicals. Anti-inflammatory, aids in wound healing, prevent atherosclerosis and accelerate tissues regeneration. Lower cholesterol and triglycerides, reduce LDL in the body and promote cardiovascular health. Rose, fight free radicals, delay aging, enhance collagen production, improve the elasticity and prevent the rupture of blood vessels, improve blood circulation. Cordyceps myceliums prevent atherosclerosis, stroke, and heart. Strengthen heart, lung, and kidney function. Raise HDL, reduce LDL. So far, I've spoken about superfood to nourish the liver, to avoid the overproduction of cholesterol, and clear the cholesterol in the blood vessels. You may think that it can reduce the risk of heart disease and stroke. Is it so? There's one more place to check. That is our gastrointestinal tract. What should we do? Earlier on, as I mentioned, there are a lot of food that contains cholesterol, and it is impossible to avoid them as everyone still wants to eat some eggs or meat. So what can we do? We can consume plant food that is rich in phytosteroids, as it can speed up excretion of cholesterol from the body. The one in the pink is our intestines, and the yellow one is the cholesterol we consume from food. After eating, the cholesterol will be in our intestines, where it will be absorbed into the bloodstream. What happens when we consume phytosteroids? Phytosteroids will compete with the cholesterol to be incorporated into mixed cells. Phytosteroids have a greater affinity for micelles than cholesterol, causing cholesterol to be excluded from the absorption process. Unable to be absorbed by the body, cholesterol in its free form is excreted. In this way, phytosteroids speed up excretion of cholesterol from the body. Research shows that consuming 2.2 grams of phytosteroids can reduce cholesterol absorption of 60% in a day. Let us take a look at the plant food that are rich in phytosteroids. 1 gram of soybean contains 0.843 mg of phytosteroids, which has the effect of lowering cholesterol. Consuming phytosteroids can reduce the cholesterol content in the body by 10% and the LDL content by 15%. Research shows that consuming 1.5 gram to 1.8 gram of phytosteroids a day can reduce cholesterol absorption by 30 to 40%, while an intake of 2.2 gram of phytosteroids per day can reduce cholesterol absorption by 60%. From this data, you will realize that it's difficult to rely on phytosteroids to prevent the absorption of cholesterol. But why do we need to mention about soy? Many people drink milk, take eggs or meat for protein. However, they also contain fats, cholesterol, cancer-causing hormones. On the other hand, soy is cholesterol-free and its protein is 2 times more than meat, 3 times more than egg, 12 times more than milk. Lower LDL and raise HDL. To date, there is no drug that can raise HDL. So it is recommended to consume soy for protein, and it can prevent the risk of cardiovascular disease. The other plant food that is rich in phytosteroids is dietary fiber. Besides, it can help to lose weight and prevent constipation. It can also lower cholesterol. There are two types of fiber, insoluble and soluble fiber. Insoluble fiber acts as a natural cleanser like a broom, where it helps to excrete toxins from the intestines, keeping the intestines clean. Soluble fiber protects the intestines with a protective layer so that it can prevent the absorption of cholesterol, thus reducing the risk of cardiovascular disease. Which plant is rich in fiber? It is psyllium husk. 71 grams of soluble fiber in 100 grams of psyllium husk prevent the body from absorbing cholesterol and fats in the diet, thereby helping reduce blood cholesterol and lower the risk of heart disease. If we want to live a healthy and long life, we must prevent the world's #1 killer, cardiovascular disease. As long as we can prevent cardiovascular disease, we can live to at least 100 years old. How to do it? Practice the way to health and longevity. To have a healthy body, we have to start from an early age. First, we must have sufficient rest and sleep. That is 6 to 8 hours a day. Next, moderate exercise. It helps to strengthen our heart and lung function, prevent coronary heart disease, increase the flexibility of the body and joints, enhance vitality, and can also promote lymphatic circulation. Stay positive and happy. When we are unhappy and feel stressed, our body will secrete corticosteroids, which will suppress the immune system. Together with a balanced nutrients by eating more vegetables and less meat. I hope that through my sharing, we will work together to stay away from the world's #1 killer, cardiovascular disease. For friends who are currently taking medication for their cardiovascular conditions, do practice these 4 ways to health and longevity. In the near future, I hope that the medication can be reduced or even stopped, of course with the doctor's advice. I wish everyone good health and stay safe. Thank you very much.
Thank you, Denise, for her professional and in-depth sharing. Now, a few pointers to take away from the presentation. So remember to take good care of your liver. Now you need to cut down on high cholesterol food and also choose your oil wisely and consume plenty of superfoods. Yeah. Okay. So with this knowledge, we can make wiser decisions to build a better lifestyle. So our next sharer, Cindy, will be sharing with us how her friend's father regains his health after coming down with a rare and life-threatening bacterial infection. Now, let's hear it from Cindy.
Hi everyone, I'm Cindy. I want to share with you my friend's father product testimonial on how he recovered from a critical bacterial infections. So back in October 2023, my friend's father fell seriously ill and suddenly lost his voice. At first, the family thought it was just a common infection, so her mom took him to a clinic. Although uncle was given an injection and medication by the doctor, his condition worsened the next day. He experienced breathless, couldn't eat, and was sweating profusely. That very night, his family rushed him to the emergency department. Initially, doctors suspected he might be infected him with pneumonia. His C-reactive protein, which is his CRP level, a marker of inflammation in the body, was very high. While the normal CRP range is below 5, however, his CRP level has spiked up to 360 milligrams per liter. He was then immediately admitted to the ICU. Despite receiving the strongest antibiotics, the bacterial infection continued to spread. So over here you can see his CRP level has spiked up to 570 milligrams per liter. A CT scan later revealed the real cause. It was not pneumonia, but from a very rare flesh-eating bacterial infection. The infection has started in his neck and spread over his lung and even his heart, filling them with pus. So this type of infection is extremely rare and typically require 3 to 4 surgeries with a risk of surgery at 50%. The surgeries involve opening both sides of his neck, performing keyhole procedure on both lungs, and creating a hole in his throat, for breathing support. So in total, there were 3 incisions were made on his body. So even the infection remained uncontrolled. His condition became critical. He suffered heart failure, irregular heartbeat, extremely high blood pressure, and although he had never been diabetic, his blood sugar requiring insulin injections. And he also needed oxygen support during this period. The doctor explained that his immune system was too weak and estimated his chance of survival at only 20%. The doctors recommended a 5-day course of immunoglobulin treatment as a final attempt. At the point of time, my friend has knowledge of nutritional immunology. She understood that while medical treatment is essential, the body also needed proper nutrition to support the immune system and recovery. So alongside the doctor treatments, her father began taking a high intake of cactus and American ginseng daily. By the 3rd day of treatment, his fever subsided. His CRP level also gradually decreased. 2 weeks later, the doctors removed his breathing tube. Even more amazing, the opening in his throat, which doctor expected would take 1 to 2 weeks to heal, closed in less than 2 days. The wound on his neck also healed remarkably well. Most importantly, his CRP level dropped back to the normal range, which is 3.2 milligram per liter, which we can see is a very good recovery. The doctors has previously told the family that this infection could have taken his life within just a few days, and that even if uncle survived, recovery could have taken many months. However, after 33 days hospitalization, including 27 days in ICU and 6 days in the general ward, uncle was finally discharged. Even after returning home, he continued tube feeding alongside cactus, American ginseng, cactus fruit, Ashara cherry, cranberry, rose, soy, and banana as part of his nutritional support. So as you all can see here, my friend's father has recovered remarkably. He now looks radiant and healthy. During his follow-up medical review, his X-ray shows that his lungs has recovered very well. He was once a smoker for 60 years, but today he no longer smokes. His heart function recovered to over 80%, and even his doctor commented that many people in their 50s or 60s might not recover so well. Although he lost 11 kg during his illness, 1 month after discharge, he gradually returned to eating normally. His blood sugar returned to normal, insulin was no longer needed, and many of his medication were gradually reduced. Today, he has returned to his normal life and can once again cook for his family, just as he always did. So, I shall end my sharing here. Thank you.
Thank you, CD. Just now, during the sharing, you mentioned some ingredients, right? May I know where can we access all these ingredients that you mentioned?
Hi MC, the ingredients that I mentioned earlier can be found in Elite Global Products. So there are Rhapsody, Rositine, and Phytofit. So my friend's father began taking 1 carton of Rhapsody daily, and by the 3rd day of treatment, his intake was increased to 2 cartons of Rhapsody per day. And after being discharged from the hospital, they continued to consume Rhapsody, Rositime, and Phytofit. We are thankful to Dr. Chen for her years of research in nutritional immunology and for developing convenient nutritional products that supported my friend's father's recovery. I hope Uncle's recovery journey reminds all of us that investing in our health before illness strikes is one of the best gifts we can give ourselves and our loved ones. Thank you.
Thanks, Cindy, for sharing with us this miraculous testimony. And also, congrats to Uncle for choosing elite products and now living healthier than ever. So, all those ingredients that Cindy mentioned, right? can be found in Elite products. So please do get them, right? And with that, I'd like to bring this disclaimer to your attention. Okay, Elite products are plant-based foods which are very beneficial for health maintenance. However, Elite does not advocate any form of self-diagnosis or medical treatment. Now, if you have any medical condition, please seek professional medical help. Thank you. With that, we have come to my favorite segment, which is the Q&A segment. Now, I'm sure that you have heard a lot of things throughout the presentation, and you probably have a lot of things in the mind that you want to ask. Okay, now this is a time for you to ask, and you can put your question in the chat box, or you can just unmute your mic to voice out your question. And also, I'm looking at the chat. You have a lot of people talking there. Yeah, chatting. It's good that you chat while you're looking at the presentation, so that you can actually type out what you have learned and all this thing. So okay, wait, hang on. Okay, I believe I saw a question there. Okay, our friend Steve mentioned that recently there has been frequent tragic news about sudden cardiac death. Why is this happening? Okay, it's a very interesting question. So may I know anybody from the Q&A team would like to address this question?
Thank you, MC. I can help answer this question. So hello everyone, thanks for such a very good question. Let me repeat the question again. Recently, there has been frequent tragic news about sudden cardiac death. So why is this happening? Okay, I'm Darren, and sudden cardiac death is currently one of the leading causes of sudden death among young people. So as we all know, heart disease is the world #1 killer. Now, let's look at the main causes of heart disease. So first is high blood pressure. Second is high cholesterol. Third is atherosclerosis, which is the loss of blood vessel cell elasticity. Fourth is excessive omega-6, which causes blood vessels inflammation. So just like those with high blood pressure or high cholesterol, sudden cardiac death often happens without any warning signs, pain, or even itching. So some patients only discover they have high blood pressures and blocked blood vessels when they are rushed to the hospital for chest pain. Therefore, today we must understand the most common cardiovascular disease, high blood pressure. So what exactly is high blood pressure? It happens when the pressure of the blood pushing against our arterial walls is constantly too high. A blood pressure reading over 140/90 indicates high blood pressure. This means the systolic number is over 140 and the diastolic number is over 90. So how does high blood pressure form? So look at the first image, we can see a normal blood vessels where the blood flows smoothly without obstructions. So in the second image, platforms as cholesterol, fats, and calcium from our diet accumulating on the walls. So this buildup causes the blood vessels to significantly narrow and lose elasticity. And this restricted flow is called atherosclerosis, which eventually causes blood pressure to rise. Now, why are people afraid of high blood pressure? So because they worry the blood vessels will rupture, causing a heart attack or stroke. And because of this fear, many rely on medication. But how does blood pressure medication work? First, it reduces the overall blood flow. Okay, think of our blood vessels as a water pipe. Reducing the water flow lowers the pressure, right? So second, it slows down the heart rate. And third, it uses diuretics to promote urination. Flushing out water and sodium help to relax and widen the blood vessels, bring the pressure down. However, this medication has severe side effects. So if our blood pressure drops too low, our brain lacks oxygen, which triples our risk of developing this dementia. Additionally, if blood flow is too low, our heart muscles won't get enough oxygen, leading to heart attacks and doubling our risk of a stroke. So many patients on medication still sadly pass away from heart attacks. Their blood pressure reading was just normal when it happened. So if we ask the doctor how long we need to take these pills, they will tell us it's long-term or for life, So medicine cannot cure the problem, but only suppresses the symptoms. So if we stop our blood pressure medication, our blood pressure will certainly spike again. So the only way is actually to fix the root cause. Now, I believe many of us want normal blood pressure without medication, right? So to do that, we must understand the truth behind high blood pressure. So things like heavy diet rich in saturated fats and meat directly lead to excessive high cholesterol. Also, as we age, right, we loses the collagen, which causes a severe lack of blood vessels elasticity. Now, how do we stay away from medication? We can lower our cholesterol and blood pressure through a healthy routine. Here's what we should do. So, maintain a good lifestyle habits. No smoking, no excessive drinking, and no staying up late. Okay? Maintain optimal liver health. Since the liver produces 70% of our body cholesterol, a healthy liver won't overproduce it. Next, reduce our intake of meat and seafood. If we have to eat a heavy meal, we should consume plenty of dietary fiber first to block the absorption of cholesterol, fats, and toxin. Now, also to consume less oil, less salt. So less oil prevent omega-6 level from causing inflammation. So if those of us who like flavorful and salty foods simply just cut out the salt for 2 weeks, our blood pressure will certainly drop. Then lose weight and exercise more frequently. So losing 10% of our body weight can lower our blood pressure by 10%. So inactivity also increases the risk of cardiovascular disease. Okay. So just follow the 4 pillars of health. Get enough sleep, exercise moderately, promote blood, which of course that will promote the blood flows, maintain a happy mood, and consume plant-based food rich in essential nutrients like phytochemicals, polysaccharides, and antioxidants to support our immune system. Okay. Now let's look at some nutritional superfood to protect the heart. Okay, first off, Hawthorn. Hawthorn actually prevents arteriosclerosis. It promotes blood circulation and helps dilate the blood vessels. And then next is blueberries, which prevents blood clots. So it reduces the burden of our livers and lower blood cholesterol. Next, blueberries. It prevents blood clots and it also reduces the burden of our livers and lower the blood pressure. Then next, cranberries. Cranberries prevent arteriosclerosis. It also prevents cardiovascular disease. Next, superfood for increasing arterial elasticity. Okay, rose produce collagen to maintain blood vessels elasticity. So it also promotes healthy blood circulation. Acerola cherry protects and purifies the blood. So it actively inhibits bad cholesterol. And then finally, we have superfoods for strengthening liver function. So a healthy liver is essential to lower cholesterol in the blood. So first is the oriental resin tree, which strengthens the liver function. It lowers blood pressure and lipids and maintains cardiovascular health. American ginseng promotes liver regeneration capability. It also inhibits the growth of liver cancer cells. Next, monk fruit effectively prevents liver inflammation. So as long as we maintain good lifestyle habits and a diet with more vegetables and less meat, we can prevent and improve cardiovascular health. So this concludes my sharing, and I hope I've answered the question. Thank you, everyone.
Thanks, Darren, for his sharing. I believe definitely you have answered the question. Yeah, so a few pointers from what Darren has shared. So remember, it's basically comes back to lifestyle. Yeah, lifestyle based on the things that you eat. No, yeah. So make sure you consume those that's less salt and anything that's lesser in cholesterol, things like that. And also don't forget about the superfood that Denise and Darren has mentioned. Yeah, I think a lot of them, yeah, they mentioned a lot of superfood. So all this superfood can be found in elite products. So do go and get them. And also, besides putting in, right, and not to mention exercise, right? Maintain a positive emotion and all this thing, and make sure you have plenty of rest. So with all this, right, I'm sure we can all avoid all this sudden cardiac death, right? So I look at the chat, right? Seems like there is no more questions. So if there is no more question, and yeah, so we'll move on to our next segment. So in fact, we have almost come to the end of today's webinar. But before we do that, you know about Elite Global, right? Elite, besides giving us the wonderful science of nutrition immunology, which keeps a lot of us healthy, right? And Elite also provide us a very good career. And at the same time, right, Elite is celebrating 10 years anniversary. Yeah, and Elite, right, not only that, brings us to incentive trip every year. So which incentive trip, right, is bringing us to next year? So let's find out. from AV team.